Welcome to our Mock Interview Pro series, where today we focus on helping you ace your charge nurse interview. This leadership role is crucial in ensuring patient care and team coordination runs smoothly. And we're here to guide you through typical interview questions with tips and example answers. Let's dive right into our first question to help you shine in your interview. Let's start with a scenario where you had to unexpectedly step up and lead a nursing team. Can you share an experience like this and how you managed it? This question is all about showcasing your leadership skills under pressure and how you handle sudden responsibilities. Here are some pointers to help you craft your response. Begin with a clear example of when you had to take the lead unexpectedly. Describe the immediate steps you took to manage the team effectively. Discuss how you communicated roles and delegated tasks efficiently. Mention any obstacles you faced and your strategies to overcome them. Conclude with a positive result that highlights your leadership impact. Now, let's look at a sample answer to bring these tips to life.
In a previous role, the charge nurse called in sick on a busy shift, so I had to take charge. I quickly gathered everyone for a brief team meeting to understand the situation. I assigned patient tasks based on each nurse's strengths and maintained clear communication throughout the shift. We faced a high patient load, but by working together, we delivered excellent care and received positive feedback from our supervisor.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for charge nurse. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Next, let's talk about communication. Can you tell us about a time when you needed to convey complex medical information to a patient or their family? How did you make sure they understood? This question is designed to assess your communication skills, especially when explaining complicated medical details in a way that others can easily understand. Here are some strategies to consider when preparing your response. Select an example that involves complex information. Break down the information into simple, digestible parts. Use visuals or handouts to aid understanding, if possible. Ask open-ended questions to confirm their understanding. Ensure there's room for them to ask questions at the end. Here's an example. Answer to illustrate these points.
When I had a patient newly diagnosed with diabetes, they were overwhelmed by the treatment plan. I broke it down into three main components: diet, medication, and monitoring blood sugar. Using a simple chart, I explained each part and invited questions from the family. They left with a clear understanding and materials to refer back to.
Conflicts happen in any workplace. Can you describe a situation where you had a disagreement with a healthcare team member and how you resolved it? This question evaluates your conflict resolution skills, focusing on how you address disagreements professionally to maintain a harmonious work environment. Let's explore some tips to help you frame your experience. Clearly, identify the conflict and why it was important. Describe your emotional response and its significance. Explain the steps you took to resolve the conflict. Emphasize communication and teamwork in finding a solution. End with the positive outcome and lessons learned. Now, let's see how you might articulate this in an interview.
Once, a nurse and I disagreed on patient care priorities. I approached them calmly to discuss our different views, listened to their concerns, and shared my own. Together, we reviewed the patient history and came to a mutual agreement on a plan, which not only improved our teamwork, but also enhanced the patient's care.
Imagine a patient's condition is rapidly deteriorating. What steps would you take to handle this situation quickly and effectively? This question is aimed at assessing your critical thinking and decision-making skills in high-pressure situations. Here are a few key actions to include in your response. Quickly evaluate the patient's vital signs and overall condition. Prioritize immediate interventions to stabilize the patient. Communicate with your team clearly and alert the doctor. Document the situation and actions taken promptly. Prepare for any potential emergencies or rapid responses. Let's look at an example to see how you can convey this in your interview.
If a patient's condition starts deteriorating, my first step would be to assess their vital signs to identify any critical changes. I'd prioritize interventions like administering oxygen or medication to stabilize them. I'd immediately communicate with my team and notify the doctor. Concurrently, I'd document all observations and actions taken to ensure continuity of care.
Finally, how would you prepare and lead your team during a hospital-wide emergency, such as a natural disaster? This question focuses on your ability to lead in crisis situations, emphasizing preparation and clear communication. Consider these suggestions when forming your response. Assess the specific emergency situation and its impact on the hospital. Regularly review and update the emergency response plan with your team. Conduct training sessions and simulations to ensure readiness. Clearly communicate roles and expectations to your team. Establish a triage and resource allocation system for efficient patient care. Here's a sample answer to illustrate how you might handle such a scenario.
In preparation for a natural disaster, I'd begin by reviewing our emergency protocols and ensuring each team member understands their role. Regular training and scenario drills would be conducted to keep everyone ready. During the emergency, I'd prioritize clear communication to address immediate needs and efficiently coordinate patient care.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free, just grab it below.